Hi there. Thanks for taking the time to view this short video looking at the Paediatric CPD program. My name is Dr. Glenn McGuinness and I am a paediatric chiropractor and the creator of this program. I graduated as a chiropractor in 1986 and I completed a 3-year postgraduate master's degree in chiropractic paediatrics through RMIT University in 1998. So let's have a closer look at this amazing program because I know you are going to love it. The Paediatric CPD program is specifically designed for those chiropractors in private practice who would like to improve their clinical competency with children but who don't necessarily have the time to commit to a lengthy course or weekend seminars. A huge benefit of this program, and what sets it apart from those weekend seminars, is that you are provided with constant 24/7 access to the material from the comfort of your own home. And the interactive learning experience with ebooks and videos can be tackled at your own pace, with no deadlines or targets to achieve. The real strength of this program, however, lies in the practical, hands-on approach, with the focus throughout on the seamless implementation of the material into your practice immediately. The program consists of 5 modules, which together are specifically designed to comprehensively address all aspects of chiropractic practice which involve the paediatric patient. From the moment that child first enters your practice, through the history taking and physical examination, the spinal and cranial assessment and adjusting, right through to the specific management strategies most appropriate for that particular child. Whether that child be suffering with an ear infection, dysfunctional nursing, a neurodevelopmental disorder, bedwetting, or perhaps plagiocephaly. So let's have a brief look at each module. Module 1 covers the initial consultation and is presented as a 96-page ebook which includes over 55 videos, as well as a child patient case history form which you can download to your computer and print on your office stationery. This form collects all of the relevant information you need from the parents, including details of the pregnancy, the birth, the child's medical history, plus so much more. This module begins by exploring the essential information you need to collect during the taking of the child's history. It details the specific and very important initial procedures and protocols involved in the child's first visit, including the examination of the neonatal baby, as well as the toddler and older child. So the information is presented in written form, clearly describing each procedure. But the beauty of this information being in digital format is that you can then click on the video to see the procedure performed for you. This makes mastering the procedure so easy. Whether this be a specific neurological examination such as this plantar reflex examination, testing for the presence of primitive reflexes such as this Galant reflex, perhaps testing an infant with a pull to sit test to determine whether the child is meeting age-specific milestones. Or testing for a postural reflex such as this Landau reflex. Your ability to understand the significance as well as to physically perform these procedures is made so much easier through the visual support of the videos. This is also true with the spinal examination of the infant. Whether this be the assessment of the sacrum, the sacroiliac joints, or perhaps the upper cervical spine, the videos ensure you are shown every specific assessment technique so that you can closely follow this with your own patients. Again, the emphasis throughout this program is on the practical application of this information. It's not simply about finding a problem, it's about knowing how best to deal with this on a practical level. So should you uncover a neurological deficit, perhaps a retained primitive reflex, This program is designed to walk you through the most appropriate management strategies for that particular child. Also included in Module 1 is a step-by-step process you can follow to put all of these procedures together when examining the infant. A method which is both thorough and time efficient. There is also a very useful description of the age-specific milestones which you should be aware of when examining the paediatric patient. This information is also covered in detail for the toddler and the older child, including the essential examination procedures during the first visit, again all supported by video, the spinal examination of the toddler and the older child, as well as the summary of the entire examination process in step-by-step format. Module 2 has proved to be perhaps the most popular module, as it comprehensively addresses the topic of cranial assessing and adjusting in the neonate and baby, as well as the toddler and older child. The module is presented as a series of 8 videos and 1 ebook. Should you already currently perform cranial adjustments within your practice, this module will be of enormous benefit to you, as it will broaden your understanding of how the cranial bones move, as well as what is specifically occurring when you perform a cranial adjustment. For those new to cranial adjusting, the information presented in this module will provide a firm grounding in the art and science of cranial adjusting the paediatric patient. On completion of this module, regardless of your current experience with cranial adjusting, you'll have a clear understanding of the craniosacral rhythm, how the cranial bones move, as well as a simple, straightforward, systematized approach to the assessment and treatment of the craniosacral system in the paediatric patient. On a practical level, this module will allow you to confidently assess and successfully manage infants with, for example, plagiocephaly and dysfunctional nursing, as well as to add an extra dimension to your ability to manage children with many other common childhood conditions, which may have a cranial component as a part of their etiology. And I firmly believe that without addressing this cranial element, you simply will not be achieving the best clinical outcome for your paediatric patients. As I said, this is a very popular module. I believe simply because of the enormous difference this knowledge can make in your ability to manage the paediatric patient, and consequently in the results you achieve with your patients. Module 3 addresses that area of practice which is fundamental to what we do as chiropractors in our management of the paediatric patient, the adjustment of the child. This module is presented as an ebook which includes over 58 videos and presents both manual, drop piece and activator adjusting techniques for the neonate and baby, as well as the toddler and older child. Perhaps most importantly, the module focuses on those aspects of paediatric adjusting that potentially are of most practical value for the family practitioner in private practice. For this reason, the techniques presented are potentially of enormous clinical value to both experienced chiropractors as well as new graduates, and are both easy to learn and, very importantly, easy to implement into your practice immediately. A variety of adjusting techniques for each area of the spine is presented, with each technique described in detail, followed by a video demonstration of the actual adjustment being performed on the child. Again, this serves to reinforce and accelerate your learning, especially with your ability to view these videos as many times as you need to master the technique. These first 3 modules will enable both new graduates and experienced chiropractors to improve their paediatric examination and adjustment skills, and as a result feel more confident in their management of the paediatric patient. At the completion of these 3 modules, you will have a simple, systematic approach to firstly examining the child for the presence of neurological disturbance due to dural tension, cranial sutural dysfunction, as well as cranial and vertebral subluxations. And secondly, you will have a clear adjustment strategy that is most appropriate for that child. Module 4 has also proven to be a very popular module, as it specifically addresses the management of the child. I believe the term patient management should encompass certainly the examination and adjustment of the paediatric patient. But in addition to this, true patient management should also incorporate any and all aspects of that child's life which you have the potential to influence that may positively impact the current and future health status of that child. Let's take the management of otitis media as an example. As a family chiropractor, this is a childhood condition which you will certainly encounter on a frequent basis. For this reason, I believe you need to have an effective management strategy for this condition. Module 4 provides you with the necessary background knowledge to implement an effective strategy to manage the child with childhood ear infection, as well as an effective strategy to manage the parents. Now, managing the parents essentially means shifting the parents' focus away from medication to a more holistic approach. One of the reasons that parents will go down the medical doctor antibiotics pathway is because of their perception that there are no other options available to them. So let's have a look at Module 4. This module discusses the various management options parents have with their child. As a family wellness practitioner, I believe you should always discuss with the parents that certainly one of the treatment options available for their child is antibiotics. However, I believe it is your duty to discuss the research that clearly demonstrates that antibiotics should perhaps not be the first approach with childhood ear infections. This research is detailed in this module and is also included in the well-referenced parent information handout, which is available for you to download and print on your practice stationery. Included in this module is also a list of essential questions that the parent should perhaps be asking their medical doctor when an antibiotic is prescribed for their child. The discussion then moves on to a more natural approach to childhood ear infections. A variety of management options is explored which will very importantly allow parents to assist in the management process. I believe this is very important. I have found that many parents often feel helpless and locked into the medical antibiotic approach. By presenting options to the parent with well-referenced research supporting what you say, you are far more likely to effectively manage that child through the ear infection crisis without the parents resorting to antibiotics. Depending on individual circumstances, this discussion may include basic information on hot and cold compresses, the importance of elevating the child's head. Perhaps you may touch on the use of natural ear drops or the referral to a homeopath, or maybe to simply encourage the mother to continue to breastfeed. You may explore the importance of diet and nutritional supplementation, including probiotics, again using research to support what you say. The discussion then moves on to how chiropractic may influence this condition, again supported by research which is included in the handout for the parents. We then discuss my chiropractic approach, in other words, how I specifically manage this condition. This discussion relies heavily on an understanding of the material covered in modules 1, 2 and 3. A discussion on the very important topic of scheduling the child with otitis media is essential reading, and then I finish off with my when in doubt suggestion. This is essentially a suggestion of how to manage that child if after examining the child you are still a little unsure of what to do next. This is great advice for those who are perhaps new to practice. The management of childhood ear infections is only one of the many conditions covered in this 70-page ebook. Once again, educational videos and photos are provided throughout to assist in the learning process. The management of each specific condition is presented as a largely evidence-based approach. The discussion of each condition is both logical and, very importantly, also very practical in terms of immediate implementation into private practice. This includes discussion on adjusting techniques, home management strategies, as well as very informative handouts for parents, which, as we have said, you can download and print on your practice stationery to further educate the parents, including your role in the management of this condition. This comprehensive management approach is detailed for each condition. Once again, as is the common theme throughout all of these modules, the emphasis here is on the practical application of specific management strategies to ensure the best clinical outcome for your patient. The end result being a chiropractor who is more confident and competent in their management of the pediatric patient. The final module in this course, Module 5, the Paediatric Special Appointment, is again presented as an ebook, and it addresses those essential special appointments that should be an integral part of your paediatric management protocol. The child report visit, the most important visit, and the child wellness visit are designed to ensure you consistently achieve the best clinical outcome for your paediatric patients. In addition to this, these special appointments are also specifically designed to positively influence the parents' views on health and wellness, so that they are in the best possible position to make informed decisions regarding the health of their entire family. This module includes the necessary forms involved with those special visits, which are downloadable to your computer for you to print on your practice stationery. So there it is, a comprehensive, all-inclusive program which will create the certainty and confidence that you need with your management of kids. So what are some of the most common questions about the program? There are continuing education hours available for each module. In fact, there is enough CPD points available to satisfy your continuing education requirements for many years to come. However, it is important to note that completing the assessments is not a specific requirement, and you may choose to progress through the program without answering the questions at the end of each module. The program has been set up in this way to cater for those chiropractors who may have all the CPD formal hours they require for the year, but would still like to improve their assessment, adjustment and management skills with the paediatric patient. How you manage your hours is totally up to you. Should you choose to complete the quizzes at some point in the future, when you may perhaps need CPD points, you can simply go back to these questions and submit your answers and receive your certificate of completion and continuing education credits at that time. Access is available online, so if you have access to the internet, you are set. You can view the program including the videos on your iPad, laptop or computer. You get unlimited access and you can watch the video presentations and view the ebooks as many times as you wish. This will enable you to review the information as many times as you feel you need to. Should you wish to have access beyond the 1 or 2 year period you have registered for, this is simply achieved by registering for a further specified time for a nominal charge. In addition to this, you can also print the ebooks should you wish to read them from a hard copy. I would like to make the point that regardless of where you are in your paediatric journey, whether you are a student, a new graduate, or perhaps an experienced practitioner, no matter how proficient you are with the assessment, the adjustment and the management of the paediatric patient, this program has something for you. Put simply, this program will make you a better chiropractor. So I would encourage you to go to our homepage to get started.
Possibilities of what I could do with the world at my fingertips. My imagination brings a smile up to my lips.